It's been a few weeks since we've communicated about what's happening with the pandemic and the coronavirus, and so I'd like to update you today. We'll talk about a few things. We'll talk about what's happening nationwide. We'll talk about what's happening in the region, and what does that mean for us as an organization and as employees of the organization. We know that rising infections are more common in areas of the country where vaccination rates are low. And so that'll be very important for us to understand as we look at our own population around here. So what's happening locally? We're seeing increasing rates and some increasing hospitalizations. We're having more tests positive in our laboratories. Our communities are seeing more infections, and our hospitals are a little busier. Although the rates of infection are rising across the country, fewer people are dying of COVID. This is for a few reasons. First and foremost, because more people are vaccinated. Secondly, we know how to more effectively treat patients that are sick with COVID. So many are asking, what has changed in the last several months that's causing the infection rates to rise? We realize that a different variant of the virus, the Delta variant, is now the most common strain in the country. And this variant is a little different. I think everyone understands that the little spikes on the outside of the virus are what helps the virus attach to our bodies. The Delta variant is much more effective at attaching to us. It grows faster and it makes more copies of itself. Because of this, it's more contagious. And this more contagious variant is causing the rates to rise. It's really important to understand that these rising rates are predominantly in the unvaccinated population. That vaccines are still very effective at preventing infection with the Delta variant. No vaccine is perfect. And these vaccines are not perfect either. There are vaccinated people who get ill. The vaccine remains very effective at preventing serious illness and hospitalization, even from the Delta variant. Vaccination remains our best tool in trying to control this pandemic. We know that the vaccines are safe. Over 400 million doses of vaccine have been administered across the country, and many more worldwide, of course. And the risk of a serious side effect is extremely low. So we know that they are safe and effective. The organization continues to look at ways that we can increase the vaccination rate in our communities and in our organization. There are two really important things that we should talk about. First, please get vaccinated. Vaccination remains our best tool to help control the pandemic, and it is safe. The second piece of advice would be, if you feel poorly, if you are having symptoms that may be related to COVID, fever, cough, chills, whether you're vaccinated or not, you should get tested. That will help us protect our colleagues, protect our families, and protect our community. Things are once again changing rapidly with the pandemic, and it's very important that you stay up to date with these changes in our organization. Because of that, we'll be communicating more frequently. It's human nature to be discouraged from the changes that are happening around us. It's a priority for the organization, and we understand it's a priority for you and your families. But our history has shown that we've gotten through this together as an organization, and our teamwork will help us get through this phase as well. Thank you for all you've done and all you continue to do for our patients, our community, and the organization.